In Full Zoom is presented by Calvo Enterprises Inc. and IT&E.
Half a day, everyone, and welcome to In Full Zoom. Our guest today is Dr. Nathaniel Berg. He is the chairman of the Governor's Physicians Advisory Group. Half a day, Dr. Berg.
Half a day, Nestor. How are you doing today?
I'm doing good. First question, of course, yesterday we had 422 new COVID cases, which is quite a lot. What's going on right now, and what are you going to be doing about it?
Okay, well, first let me address the 422. I think it's that number is not surprising to the advisory team to the governor, including the Physicians Advisory Group. We predicted, and I'm not gonna say we were special, we did it as a group because based upon data that's out there. We predicted that after people came home from off-island travel, that some members would bring Omicron here. And I do see that people are saying we don't have it proven yet by having it genetically analyzed, but I think the people of Guam can be assured this is our Omicron surge. So how fast it spreads and how big our community is, we knew, if you will, that we would be up in the 400 range. In fact, it's not going to surprise me if we get to somewhere around 500-600 as the peak of daily counts, given our population and our population density, how crowded we live. So that doesn't surprise us, the numbers. The percentage doesn't surprise us, and the rapid growth in the numbers doesn't surprise us. So the response to that is, as long as things continue in the way that we anticipated and prepared for, we're okay. I think Guam can be very proud of ourselves as a community in that we prepared for this. We back in, you may recall back somewhere in December, we were talking and saying, now is the time for people to prepare. Now is the time to get fully vaccinated. And then the term that we came up with of fully protected, which means you've got your vaccinations plus your booster shot, that the majority of people, I think, listened to the advice of us that we're not doing this for anything other than, but we want to protect our own community to the best of our ability. And the critical thing there that was that we were telling people who were vulnerable, the people who had I think just about everybody in Guam has learned this term, comorbid conditions, meaning other significant illnesses that they might get if they are infected. Things like hypertension, high blood pressure, that is, or obesity, diabetes, and things that put you at risk if you do get, at higher risk, that is, if you get infected with Omicron. And our hospitalization rates have remained low. Our death rate is extremely low. In fact, we haven't had anybody who's been fully protected or fully vaccinated die yet from Omicron, and we have a very low hospitalization rate overall, with only one person in the ICU at the moment. And that we are confident is due to the fact that those who had these comorbid conditions got fully vaccinated and fully boosted in advance, right? There are still some people who need to come in and get that done, but we think the majority of people have done it, and that's reflected in that. And I think if you want a comparison, compare the rest of our country. The United States of America as a whole has a record number of COVID admissions right now. It's huge. I don't know if I can say record, but it's actually, I think I read this morning that it is at a new high, but that's not true on Guam. And we think that that's because the vulnerable people who are likely to have gotten hospitalized and potentially die they listened to the advice of their own healthcare providers and the leadership team, public health and the like, and went ahead and got protected. And so we are seeing a better outcome than the rest of the United States, and maybe better than the vast majority of the world. And I think I'm hopeful that that will be sustained, that we continue to see that. So that's in keeping with what we had planned for, and we hope that it continues this way. If it does, we need to continue to get testing. And if people say, why should I get tested? It's to slow the rate down. So we have a fear still that hospitalization rates may go up, And that would put the community in danger of not having enough healthcare resources. And why is that a particular concern here? Even though the hospitalization rate is not so high right now, it's because so many people have Omicron right now or are isolated, and we'll talk a little bit about that, but that it's impacting the function of the community, which of course includes the healthcare community. So our clinic has a number of people out. I don't know any clinic that doesn't. We have multiple businesses that are sort of having to react, and they're able to do it. But if it got much worse, if the spread was further, if you will, out of control, then we might have not have enough peace officers, GPD that is, would be affected by it, the fire department, power, GPA, all of us in addition to healthcare. So given that our healthcare workers are so frequently exposed, we anticipate that there'll be short staffing. So although the number of beds is wide open, we need to make sure that we have enough people to take care of people who are admitted to the hospital. That means that you come and get tested. If you're tested, you go home for 5 days. We believe that 5 days is adequate at this time. Seems to be worldwide. Everybody's cutting down to 5 days. And that way we at least slow the spread to the best of our ability. Closing the schools down, closing businesses down, we don't feel is necessary at this time. I know that the governor keeps it in her hip pocket. If she needs to do it, she will. And we can do that rapidly. We're prepared to do that as a community rapidly. But we don't want to do it now because we're already kind of stretched thin and shutting everything down. We don't see that in the rest of the world that has been effective in slowing down the spread of Omicron. So we're trying to use evidence-based actions. If one country completely locks everybody down and there's no big impact on the spread of COVID, then why, or that is with the Omicron, then why would we do that unless we have evidence that it would be beneficial to the community? Right now, we actually think it might be worse.
In Full Zoom will continue in just a moment.
In Full Zoom is presented by Calvo Enterprises, Inc. and IT&E. GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information. In Full Zoom is presented by Calvo Enterprises, Inc. and IT&E.
Yeah, if I'm hearing you correctly, I think what you're saying is that even though we have these 400 plus positive cases, because they're not flooding the hospital, there's no increase in hospitalizations, that it shouldn't be as concerning to most people?
That's correct. It's not, we're members of this community too, right? So we share the concern about the high numbers, but as more importantly, and even more importantly than the CAR score, is the impact that that number is having on our healthcare system, on the patients who are most vulnerable, and then the impact that it's having on the necessities of the community. As I mentioned, the GPD, GFD, and the like. So we're okay with sort of saying, stay the course. We believe that we should get through this in a couple weeks, and that if it stays like this and doesn't get any worse, that those people who had it 5 days ago will start to be able to come back to work, right? So we just hope that, let me make up a number. So if GPD says we can function with about a fifth of the people out, we're hopeful that it's no more than a fifth at a time, and that every day that those who are out for 5 days are now able to come back, so that we won't have a significant impact. When you call for a police officer, he or she will be available. When you go to the hospital, there will be a nurse in the emergency room. They won't all be out sick at the same time. We think that what we're doing right now is effective. I think it's easy to play so-called Monday morning quarterback, that a year or two from now, somebody may look back and say, oh, the advisors made a mistake. That's possible. But I think that, in fact, it's likely that we will have made choices that turned out not to be the right choice somewhere in this. We don't have a crystal ball. But what I want the community to know is that we are thinking about this, we are planning, we are not reactive. We've been thinking about this. They know that, people know that, and should feel assured that this is not us just looking every day and thinking, what do we do now? We planned and thought about this since at least a month ago. And so we're carefully assessing it. The CAR score is the only tool we had a long time ago. It's useful to a certain extent, but it's only one piece of data that now is multiple data sets that we use to make our decisions. Sorry, I'm going to turn my phone off. I need to do that.
Yeah. You mentioned a CAR score. Since you did, is that no longer relevant?
A CAR score is relevant. I'm sorry, I'm going to turn the phone off. Sorry about that. It is relevant, but it's not as nearly as important. I'm embarrassed. Sorry about that. I should know better, but of it is. Okay, so the CAR score is relevant, but we feel it's more relevant at the lower numbers. Once you get up above a certain level, it's no longer going to impact the decision making we make as much as it did before. It's just sort of part of it. But when you're going from 1 to 3 to 5 to 7, once you start getting above 30, 40, it doesn't matter anymore. It's not going to change what we do. We have to look at the root cause of why it's so high. And we know what that is, that Omicron is so incredibly infectious and transmissible. So it's not going to change what we do now, but when it's at very low numbers, we feel it's more important there.
Yeah. So the Biden administration is pushing for home testing. I think public health has said that it will be ordering those home test kits. Will that have an impact on the public health authorities' ability to know just how pervasive the infection rate is out there?
Yeah. So
how would you guys know? In other words, if I'm,
right.
Because there's no.
It's a double-edged sword, right? In that, meaning that it can be beneficial and also be detrimental. It's beneficial in that people don't have to come to clinics or go to to Teads-In or what have you in order to get tested. They could do it at home with an accurate test. And maybe there's slightly less accuracy by people doing it themselves versus having someone who's trained as to how to take the samples. But we think that society will benefit by people being able to test themselves at home for sure, without having to come in, meaning more people will be tested. The problem with it is, as you sort of alluded to, is people may not report their positive results to public health. So we're trying to weigh that now. We are going to get tests. They've been ordered, and we want to get them in the hands of people so that they can do home tests for sure. And we also think we may be able to combine that, which means when people come in for tests, if they're positive or they say that other family members were exposed, that we can hand them the test and maybe show them at the same time how to do it properly, how to take those tests. Fortunately now, most of the newer tests, including the ones that public health is using and that we're using, you don't have to feel like they're poke the back of your brain. They don't have to go in as far, and with nearly the same accuracy as a PCR test. So that's good news on the horizon, that you won't have to come in. But even if you do, it doesn't have to be so traumatic. I've had a ton of them myself, and I'm kind of used to it by now, but it's not fun. I don't think anybody wants to get another test if they don't feel it's going to help them.
Yeah. So I wanted to go back to those 422 cases. Would you consider this a surge?
Oh, for sure.
Yeah.
We're in the middle of the Omicron surge, which is our fourth surge. So we had the Alpha, we had 2 surges from that. And then we had the Delta, and now the Omicron. And the thing I think people need to understand, why we're not giving them names just because they're a little bit different. They really behave quite differently, right? And that's an important distinction to know, that why people are saying, do we really have Omicron? We know by the way it's spreading, it has to be Omicron. It just has to be. Delta affected children more and people got sicker. Here it spreads more rapidly, but anecdotally, meaning just in my personal experience, I'm seeing less illness in children, less infection in children, and I'm seeing incredibly widespread infection in adults who have less exposure than they used to have, meaning they could say, I visited a friend for 10, 15 minutes, and then they come back and they're positive. Versus previously, you kind of had to have a little bit more exposure to be positive. You could be at a party where you were close and no masks and maybe talking loudly. Those were spread air events. Now it doesn't take much and people get it. But fortunately, not as sick. So that's why it's important for us to know what variety we're dealing with. I'm not a betting man, but were I a betting man, I would bet that we have virtually no Delta on this island at this point. And Alpha, the original one, is gone. And that was very different. That behaved very, very differently. Didn't affect children very much. Delta infected children and got them sicker. I might point out we only have one child in the hospital right now, despite having 400 positives yesterday. We only have one child. And if I'm correct, the child was coincidentally found to have COVID, meaning he was admitted and then found to have COVID but isn't sick with COVID. And we're being as transparent as can possibly be, meaning everybody who comes into the hospital and is tested positive for COVID is being reported. We thought about splitting that up and saying we should really only be reporting people who were admitted because of COVID. That number is even smaller than the numbers that you're seeing. So we want pure transparency. So we don't want to say, oh, we have even smaller numbers than we do. But reality is there are probably even fewer people who are really admitted because of COVID alone, which is great. And I no matter what anybody says, I'm ascribing that to having vaccinations and the people who were vulnerable. By the way, I can say, Nestor, that in Hawaii, the week before Christmas, every single person who died had significant comorbid conditions and had not had a booster dose, every one of them. So here we are in Guam, we've got plenty of very sick people, but our ICU is near empty. So I'm happy and proud of how we've done, actually. Even though the numbers are high, we'll get through this and hopefully have further immunity to COVID after this.
We'll be back with more In Full Zoom. Please stay with us.
In Full Zoom is presented by Calvo Enterprises, Inc. and IT&E. GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information. In Full Zoom is presented by Calvo Enterprises, Inc. and IT&E.
Yeah, I wanted to, that was going to be my next question, the further immunity, because this does spread rapidly, but is not as serious, does not have as serious an effect. Does that kind of lend it to just letting it run and give people that natural immunity of getting the disease, you know?
The answer to that is yes. But so that if I did have a crystal ball that said, if we let it just run its course and it wouldn't get so many people who work at the hospital sick, so many people who work for GPD, GPA, and the other essential functions of our community would not be threatened, then I'd say, sure, just let it go. And in point of fact, I had a friend who is a healthcare provider who said, I hope I get Omicron. I'm not going to go so far as to say that, but I'd say if one is in the mainstream or in the big population, this should not be a threat to those who are not significantly ill. And if you are fully vaccinated or fully protected and you get Omicron and you do well, the reality is, right, at least I would say the preliminary data shows that those people are highly protected. That's from the South Africa data. It looks like that they're highly protected if you were vaccinated and have Omicron. So, like I said, I think if we can get through this without many people getting hospitalized and dying and not a threat to our overall function of the community, we may come out of this stronger. I'm cautiously optimistic that that's what's going to happen. And we'll all get through this as a community, supporting one another, isolating when we're positive, very, very careful. The 3 W's become incredibly important now because of the infectious nature of this disease, to really distance yourself. Don't go out if you don't really have to. That's what I'm doing. I hate doing that because I don't want the restaurants and the like to suffer. But I'd say cautious right now is if you go out, maybe sit outside, really only go with family. But to mandate that, no, I wouldn't do that. I would just say as a general sort of common sense during a highly infectious part of this pandemic is kind of limit your exposure to people to the best that you can. And that's really to everybody, just so we can slow down the transmission rate and then accomplish what you said, let it go through the community, but in as controlled a manner as we can do, given how infectious it is.
Yeah, and so you believe that this highly infectious part of this variant will be over in a couple of weeks? And what makes you say that?
Because that seems to be what's going on in other countries. In those countries where there's a dense population, right? So if it has to spread out further to the countryside, say, for example, in Iceland, it's going to take longer because it's got to spread out to those farming communities where people don't have as much as frequent and high intensity exposures, I guess you could say. But in the denser parts of the cities and countries where the populations live closer to one another, it generally peaks at about 3 weeks. So we think in Guam, maybe a month. So you're talking about February 1-ish. I hope that we will start slowing down. Again, our peak is probably, I hope it's 400, but it's not going to surprise anybody who's been working with this if it peaks at around 600. 500 to 600, I think, is realistic, especially because we have a large number of people getting tested every day. Other communities probably didn't test as much. So that is very good for us. The numbers look higher, but I think other communities probably had higher numbers. They just weren't getting tested. And we're doing everything we can to increase availability of testing.
Stick around for more In Full Zoom. We will continue in just a moment.
In Full Zoom is presented by Calvo Enterprises, Inc. and IT&E. GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information. In Full Zoom is presented by Calvo Enterprises, Inc. and IT&E.
Doc, is there a light at the end of the tunnel that you see where we will be able to lift the emergency?
Absolutely. And Nestor, I hope that this is it, right? That COVID will be hit really hard by Omicron. I'm talking about the COVID pandemic, because we hopefully will have a huge degree of immunity in our community. We don't know how long the vaccines last, and there's this continuous talk of additional boosters. And even among the physician group, I hear people talking about, should we get a fourth booster? What we hope is the so-called herd immunity, it isn't so-called, it's a reality, of herd immunity may become our reality if enough people get infected with Omicron, in addition to those who had Delta, in addition to those who had Alpha, that we hope that all of that will build immunity so that we won't have to continuously get vaccinated and shutting everything down. So I'm so reluctant to give a time period, because I would have, before Omicron, I would have told you by now we'd be open. But I would say be cautiously optimistic, again, that this is it and we're done. I mean, that's what we're praying for, all of us, right? That we can't continuously have our lives controlled. Right now, we need to have our lives put on hold for a little bit because of this. But I think that the anticipation that this will be the end of it is reasonable. And that's not totally non-scientific and just hope. In the 1918 flu pandemic, it basically went around the world 3 times. And then the last wave was extremely infectious, but that was it. And then it died out. And in medical school, we were told that it died out because it had altered or became a variant that was very infectious, but didn't kill people. And it went away after that, because that was the dominant variant. We don't find Alpha variant anymore. We don't find Delta variant. We hope Omicron is done, and no new variant will be able to infect people who have the combination of prior infection and vaccination. We hope.
So this,
yeah. Go ahead.
So Omicron could be the endemic variant if there is such a thing.
Pray hard. Yes, but it's not an unreasonable thing to pray for. That it may be real. That this may be the last part. And I can't say it other than to say, I don't see what threat is down the road. I hope we're okay. There's nothing out there that is worrying me at this time other than the unknown.
All right, Doc, got about a minute left. You want to wrap this up? Anything you want to say to the public out there?
Only thank you. We are a community that cares about our Manumco, cares about our vulnerable people. And I think we have done our best to protect everybody and to take our Manumco in. The public health has been really good at getting out there and even getting to the homeless who oftentimes have many illnesses. And I think for right now is to say it's okay. The numbers are really high, but we're doing okay. And that's because we prepared as a community. So most I want to say thank you and tell everybody just keep listening in, and we promise we'll keep everybody posted with as much information as we get. We'll share it with everybody.
All right, Dr. Nathaniel Berg is the chairman of the Governor's Physicians Advisory Group. Thank you so much for joining us.
Thanks, Nestor. Take care.
All right, I'm Nestor Licanto. That's it for In Full Zoom. We'll see you again next week.
In Full Zoom is presented by Calvo Enterprises, Inc. and IT&E.